Hello, my name is Honey Smith. I'm a GP in East Sheffield, and I'm also the chair of Greener Practice, which is a network of primary care workers committed to reducing the carbon impact of primary care and improving its sustainability. And one of the main areas that we need to focus on is asthma care, for reasons that I'll explain to you. So I want to talk to you today about improving our asthma management and how you might manage your own asthma if you have asthma for the benefit of yourself and the planet. Now, I guess the majority of you won't have asthma who are on the call today, but even if you don't have asthma, you may well know somebody who has a respiratory illness, a relative who has asthma, or somebody who has COPD, for whom some of this might be relevant. COPD is chronic obstructive pulmonary disease, for which the rules are a little bit different. But as I say, you may well know somebody who has asthma that you can share this information with. So what could we be doing better in terms of asthma care and improving control and giving benefit to the planet at the same time? So why is the climate and ecological emergency a problem for people with asthma? Well, climate change causes respiratory illnesses, that's illnesses of breathing, and also makes them worse. Air pollution can cause asthma, and climate change increases water and air pollution. So it compounds the problem of climate change and increasing temperatures. Increased temperatures due to climate change lead to increased levels of ground level ozone, which cause airways inflammation and damage to lung tissue. And the people who suffer most from ground level ozone are children, and also the elderly, people with existing lung disease, and people who are exposed to high levels of air pollution when they go outdoors and spend a lot of time outdoors. Now, you may or may not have heard of the absolutely tragic case of a little girl called Ella Adu Kissy Deborah. Ella lived within 25 metres of a very, very busy road called the South Circular Road in southeast London. That's a road that travels around the outside of London. And it was known to have very high levels of air pollution because of the incredible levels of traffic in that area. And Ella had a severe asthma attack and died at the age of 9 as a result of a severe asthma attack. And she was the first person in the UK to have air pollution listed on her death certificate as contributing to her cause of death. Now, deaths from asthma are thankfully rare in children, but air pollution is one of the things that contributes to unstable and brittle asthma. And if you suffer from asthma, you may already know that. And there's lots that we can do to prevent asthma deaths, which we really do need to think about. So this is the reason why I want to talk about this today. So just for a few minutes, I wonder if the teachers could pause the video and just get you to think about what asthma actually is. What do you understand about what asthma is and what the process is that's going on in the lungs of somebody who has asthma? And I'm going to explain that to you. Okay, so let's go on to explain a little bit about asthma. So on the left, this picture on the left is what a normal bronchiole looks like. So a bronchiole is the breathing tubes near the bottom of your lungs, okay? And what you'll see is a nice, healthy pink tube with a nice wide tube in the middle, a nice wide opening in the middle that the air can travel up and down. And that's what a normal bronchiole looks like. But somebody who has asthma has significant inflammation in their airways. And if you think about inflammation, if you think about the last time you were bitten by a mosquito and what happened to your skin, you get swelling, you get redness. In the case of a mosquito bite, you also get itching. And that's all part of the inflammatory process that is happening because of the histamine that's released in the skin. And asthma is very similar to that. Obviously, you don't get itchy airways, but you do get swollen, red airways. And the problem with that, as you can see, is the outside of the tube stays the same, but the inside of the tube is really constricted. So it's much harder for the air to get in and particularly to get out from that airway. And that causes wheeze, which is the because of the obstruction in the airway. There's a sound that's like a wheezing sound that is generated by those narrowed airways, a bit like when you play a flute or something like that, and you blow the air across the very narrow opening on the flute. That creates a whistling noise, and the same happens to asthmatic bronchioles. So to treat asthma, what we have to do primarily is to reduce that inflammation. We can just open up the passage with a thing called a short-acting beta agonist, or Ventolin, or salbutamol as you might know it. That opens up a passage by opening up the whole tube, making the whole tube bigger, but it doesn't reduce the thickness of this wall. So there's a limit to how much you can do that. And while you've still got inflammation in that wall, you've still got active asthma and a potentially very dangerous situation. So the rule is, if you're needing to use that blue reliever inhaler, that Ventolin or salbutamol as you might know it, 3 or more times a week, it might mean that you have inflamed airways, like this picture on the right, and that you need to increase your preventer inhaler, which is the anti-inflammatory inhaler, or usually steroid inhaler, that reduces the thickness of the tube, of the wall of the tube. And it's dangerous to continue to have a lot of inflammation in your airways without addressing that issue. So if you use your salbutamol or Ventolin reliever more than 3 times a week, even if it's just when you're doing sport, ask your parents to make an appointment for you at the GP surgery as soon as they can. Your doctor or nurse might need to give you a higher dose of a preventer inhaler to reduce any inflammation in your lungs. You could also check your inhaler technique by watching Asthma UK videos to make sure you're getting it right. And I might suggest that your teachers perhaps show you the Asthma UK video for a metered dose inhaler and a dry powder inhaler, so that you can see how to do that. So let's look at it from the other point of view. So that's in terms of how we help people to feel better with their asthma, so they can live essentially normal lives apart from having to take their inhalers. And that's terribly important to prevent situations like what happened to Ella Adu-Kissi-Debrah. But the other side of this is the impact that asthma treatment has on global warming and carbon emissions. So in primary care, the carbon emissions come mostly from clinical work. It's not from the buildings, it's not from the light bulbs or the insulation of the buildings or whatever. It's from clinical work. It's the drugs that we prescribe and all the clinical work that we do. And that's 60% of the carbon emissions come from clinical work. And 13% of the emissions in primary care come from metered dose inhalers alone. That's the main inhaler that we use in general practice to treat asthma. And I'll explain that to you. So the types of inhaler are on the right is one called a metered dose inhaler. And that's one where you take off the lid, you shake it, you put that end into your mouth, and you start to take a slow, steady breath in over about 6 to 8 seconds, whilst activating the canister by pressing on that canister on the top, that bit at the top. It's quite difficult because you have to coordinate the 2 movements. And then the other types of inhaler are dry powder inhalers. So those are various different sorts. These are 3 different sorts that you might be prescribed. And these are much easier to use because you activate the inhaler by either clicking the bottom or clicking that lever on the top to activate it. And then you have to just simply take a quick breath in to suck the air into your lungs. So that metered dose inhaler has propellant in it, and that's how the medication gets into your lungs. It's pushed in by propellant. But the problem is that the propellant is very bad for the environment. So it causes enormous carbon emissions, whereas the dry powder inhaler is activated by your breath. And for most people, that's very easy to do. Few people find that difficult to get enough breath in, but the vast majority of young people find that very easy technique. So the metered dose inhaler, this one at the top, every time we use 1 metered dose inhaler, which has 200 doses in it, it's like driving 175 miles. That's the journey from London to Sheffield. But if we use a dry powder inhaler, then it's like driving 4 miles in a car. So that's from London to another bit of London. So it makes a massive difference. And also, this inhaler, even after we've finished using it, continues to give out greenhouse gas emissions if it's sent to landfill. It will keep on pumping out carbon dioxide equivalents. So in the UK, we prescribe 70% of inhalers as metered dose inhalers, and that's compared to 13% in Sweden. So in Sweden, only 13% of inhalers are prescribed as metered dose inhalers. We would save 550 kilotons of carbon dioxide a year if we switch to the Swedish patterns of inhaler use. And we know that Swedish asthma care is at least as good as ours and probably better. Now, there's a lot of other things involved in that. So different levels of smoking, different levels of air pollution, all sorts of other things that might play into that. But we know that it's certainly not less good than our care. So we know that patients in Sweden aren't suffering from having dry powder inhalers. So there's really no reason why we couldn't go to a Swedish pattern of usage. The most important thing is that you have the right inhaler for you, because the right inhaler for you is the one that you will be able to use correctly. So if the only one you can use is the metered dose inhaler, then that's infinitely better that we keep you well controlled than that we worry about those carbon emissions, because obviously it's better for you, and it's also better for the planet, because if you are not well controlled with your asthma and end up in hospital, that's bad for you, and it's not good for the planet, because hospital emissions are very high carbon intensive. So when you're a little child, little children have to use a metered dose inhaler with what's called a spacer or volumatic, and that's what this little boy is using. So he's using a chamber where the inhaler is squirted into that chamber, dispersed into that chamber, and then he can just take normal breaths in and out to get the medication into his lungs. And little children can't coordinate the use of a metered dose inhaler without the spacer or a dry powder inhaler. So when you're little, you have to have a metered dose inhaler with a spacer. But as you get older, you're much more likely to be able to use the dry powder inhaler. And in fact, it's highly likely you'll find it easier than the technique for using the metered dose inhaler. And I guess some of you who have asthma will know that when you get to secondary school, it's unlikely that you're going to want to carry on using that spacer, even if you were using it as a small child, because it's a bit embarrassing, isn't it, getting out of your handbag and or your school bag or whatever, and you can't, if you're a boy, you can't carry it in your pocket, and having it sort of in a school bag or backpack is a bit cumbersome, and you're not likely to want to get it out in front of people. So learning how to use a dry powder inhaler can be really helpful for youngsters as they start to think about going to secondary school. So it's worth having a go with the dry powder inhaler around that time when you would be going to secondary school, so that you don't have to get a huge volumatic out of your pocket or out of your bag. So the advantages of dry powder inhalers is it's easier to get the inhaler technique right, because it's a fast action. So it's kind of breathing out and then, as opposed to a very slow intake of breath. And you've got no embarrassing huge spacer. There's a dose counter on the device so that you know when it's empty. With the metered dose inhalers, it can be really difficult to tell. So you can either be sucking away on an empty inhaler or wasting quite a lot of the inhaler because you don't realize there's some in it. And the dry powder inhalers, as I say, are much less bad for the environment. So If you want to help reduce the carbon footprint of your inhalers, ask your asthma nurse whether you can try a dry powder inhaler, and they can take you through showing you those videos and helping you to practice using a dry powder inhaler. You might not be ready when you first try it. You might have to have a few goes over a few years, but you can keep checking this with your nurse when you attend. So keep asking your nurse if you can change to a dry powder inhaler, whether that's feasible for you. But the most important thing is that whichever inhaler you use, the medicine gets to your lungs correctly, because it's not going to be doing much good if it's sitting on the back of your throat. So the most important thing is that you use your inhaler correctly to get the medication into your lungs. And for most people, this will mean either a metered dose inhaler and a spacer or a dry powdered inhaler. And whichever inhaler you use, when your inhalers are empty, take them back to a pharmacist for safe disposal. It's really important because metered dose inhalers keep on giving out dangerous greenhouse gases if they go into landfill. Now, at the moment, most pharmacists will take back inhalers and they'll be incinerated as clinical waste. There are from time to time recycling schemes around the country. There's one running in Leicestershire at the moment, but there's nowhere else in the country. The one in Leicestershire may be rolled out around the country, but we don't know yet. But so at the moment, it's very difficult to recycle your inhalers. You can't put them into the doorstep recycling. And you could potentially, I suppose, put the plastic section of the metered dose inhaler into the recycling at places like supermarkets, but the canister must go back to the pharmacist for disposal, and that, as I say, will be incinerated. But if you do find any inhaler recycling schemes, they do spring up from time to time, then please take any of your inhalers to those recycling schemes. So the other thing that's worth mentioning is, as we talked about with Ella, Adu, Kissy, Deborah, it's incredibly important for people with asthma, and really for everybody, to avoid high levels of air pollution if we can, because air pollution is dangerous not just for asthma, but for all sorts of other conditions as well. So walk or cycle when you can, if possible, in a route away from traffic. So going through a nice park or something like that is ideal. If you are walking or cycling, obviously you're not contributing to global warming by being in a car, and you're not contributing to air pollution by being in a car, but you're also, as a cyclist, less likely to be exposed to everybody else's air pollution from their cars, because you can zip past quickly. So you're less at risk of exposure, even than if you're sitting in a car yourself in a traffic jam. So if you suffer from asthma, you might want to check out when pollution levels are high in your area, and you can do that via the DEFRA website. Obviously, that's not always practical, but if it is practical, and you certainly, particularly if you know that air pollution affects your asthma, it's well worth doing that. When you're indoors, try and keep warm by insulating your home rather than by turning up the gas. So that might be drawing the curtains in the evening, putting draft excluders across the bottom of the doors, sealing the windows, any gaps in the windows, putting in loft insulation, double glazing, and so on. Don't smoke, and ask adults not to smoke in your house. It's incredibly important for people with asthma that they don't take up smoking. It's important also that adults don't expose you to cigarette smoke, because it's a major contributor to asthma exacerbations. In other words, worsening of your asthma. When you're cooking, or when your family are cooking, use an extractor fan, or if it's feasible to do so, open the windows when cooking to let out any air pollution that's accumulating because of the cooking process. You could also, as a more sort of general public health measure, if you like, ask your parents about signing up to a green energy provider. Because the more people sign up to a green energy provider, the more provision there is of green electricity. So not electricity that's produced by burning of coal, but electricity that's produced by solar panels or by wind turbines. Now, it's really important that's a green energy provider and not a green tariff from a standard provider, because if you go onto a green tariff, that's provided by a company that deals with fossil fuels, all they do is give you the green tariff and everybody else gets the dirty energy. What you need is a green energy provider who is investing all of their, or most of their profits into more provision of wind turbines and solar panels and the other means of generating clean electricity. So that's really important. You might also want to get a carbon monoxide alarm in the house. That's really important, particularly if you have any gas fires or open fires or anything like that, because carbon monoxide kills people. It's a very, very serious and dangerous toxin. And use your power as young people to campaign for cleaner air. Write to your MP, write to your local council, ask for no traffic routes or low traffic routes, because that's really important. We need cities that are based around active travel and low pollution levels. It's incredibly important for your future and the future of your own children. So, thank you for listening to my talk about asthma. You might just want to spend a few minutes with your teachers talking about what it's like having asthma and how you might improve your asthma control if that's a problem, and what it feels like having to take inhalers all the time. But thank you for listening, and thank you for considering talking to your healthcare provider about reducing the carbon impact of your asthma care whilst keeping yourself well at the same time. Bye-bye.